I'm going to be demonstrating donning PPE, gown and gloves, emptying a urinary drainage bag, measuring and recording urine output, and doffing PPE with hand washing. I'll go ahead and get started. I'm going to sanitize my hands before I enter the room. I'm going to apply my gown with the opening in the back. I'm going to tie the gown at the neck. Do my best to cover my entire back, and I'm going to tie it in the back as well, always in a bow with these. Then I'm going to take my gloves and place them over the cuff of the gown. So once again, make sure I get the gloves over the cuff of the gown, and then I'm going to enter the room. Hi, Mrs. Smith. My name is Katie. I'm your CNA for today. I'm just here to empty your urinary drainage bag and measure and record urinary output. I'm going to go ahead and pull the privacy curtain. I'm going to gather some belongings here, or some equipment here. I have an alcohol wipe. I'm just going to open that up, set it on a barrier, and place it here. I'm going to go ahead and place a barrier over next to the sink as well. And then Mrs. Smith, I'm going to go ahead and raise your bed up just a little bit here. Slide your table to the side. All right, Mrs. Smith, I'm just going to empty your drainage bag. Just going to clean the tip of the drain with an alcohol wipe. Place the drain back in the slot. All right, Mrs. Smith, I'm just going to be right here next to you. I'm just going to measure and record. All right, so I'm going to put my graduated cylinder on a flat surface under a barrier, or on top of a barrier, and I'm going to make sure that I'm measuring in milliliters. Some graduated cylinders have cc or milliliters. Cc and milliliter are the same measurement. I want to get eye level to go ahead and record. I'm going to take my measurement form and print my name where it says candidate's name, sign my name where it says candidate signature, and under urine output, I'm going to put the total amount of milliliters that I just measured here. Then I'm going to take the contents of the urinary drainage bag and place it directly in the toilet. I'm going to take and get water to rinse out my graduated cylinder and place that in the toilet. I'm then going to dry my cylinder. I'm going to make sure this goes to our nurse evaluator. Get rid of any trash. Put back all of my equipment where it belongs. All right, Mrs. Smith, I'm going to go ahead and lower your bed. I'm going to make sure your belongings are within reach here. Make sure you have your call light directly in your hand. Would you like your privacy curtain open or closed? Okay. Are you comfortable? Do you need anything else at all? Great. If you need anything, just hit that call light. We're happy to help you. All right, Mrs. Smith, I'll get this situated for you. All right, Mrs. Smith. If you need anything at all, I'm just going to remove my, doff my personal protective equipment and wash my hands on my way out. Thank you. Come over to the exit where I'm going to remove my gloves first. Going to untie the gown at both the neck and the waist. I'm going to take one hand, place two fingers underneath the cuff so I'm not touching the outside, pulling my other hand in, and then I'm going to sort of ball up part of the gown here, grab the other sleeve like so, avoid touching the outside of the gown, turning the gown inside out, rolling it away from the body and directly in our hamper or the trash, depending on the type of gown that you have. I'm then going to go directly to the sink. I'm going to turn on the water and I'm going to wash my hands for a minimum of 20 seconds. And I'm finished.